Welcome, Dr. Damji.
Thank you, Dr. Wala. And it's my real pleasure, and I thank the organizing committee for giving me this opportunity to share with you a very important topic in our patient care, and which I believe that is an important aspect of our day-to-day life. So the basically we historically we involved in a disease-centered care. So where we define the patient with their diseases. So this patient has CKD, and we followed a very strong, rigid pathway of guideline-centered treatment pathway. Whereas now we should move into a patient-centered care, where we should treat the patient as individuals, not just treating the disease, as you said correctly, but to treat the patient as an individual. And the patient and the healthcare provider should have a strong bond in decision making, in sharing the information. So that is what all about we are going to learn. So here in the nephrologist's tale, this is the story of us, what we do on our day-to-day basis. We are more looking into the dialysis adequacy. We look how to control the blood pressure. As Dr. Naima previously said, that we are more concentrating or focusing on improving the quality of dialysis, which is very, very important. I agree. But as the cartoon next to me, next to the picture, depicts that the patient is sitting there, looking very depressed and dull. But the healthcare providers are more concerned about the potassium level of the patient rather than looking at the patient and what is going through his or her mind. So these aspects has to be emphasized in the patient-centered care. So this is a reality I think we see when we go to our units, a lot of disability, a lot of non-functionality, and which really hurt me that why the patients are not happy or not so functional. And that's why comes this whole point of a patient-centered care. So the studies has shown that as the duration of dialysis increases, the functional capacity of the patients reduce, especially in the elderly, especially in the patients with other comorbidities. But can we do something? Can we do something beyond our scope to help these patients to be have them more functional status? Not only the physical functionality, but also the mental health we should be looking into. We know that our patients in dialysis are having moderate to severe depression, and most of the time we might be overlooking them. So we should be concentrating and focusing on their mental health issues. They might be anxious of starting the dialysis. They might be having some kind of stress. So these factors also has to be addressed equally. So this should be the model where the patient should be in the center of the treatment plan, and all these phenomena should address to improve the quality of life. As you say, this involves all the parameters what previously talked about should include, but also the patient should be the center of the treatment. And the major goal or the aim should be to improve the quality of life of the patient. So to deliver the adequate dialysis, we know that we need a strong interdisciplinary team, which includes the dietitian, the physician, social worker, and the dialysis nurse or technician. Whereas when we talked about a patient-centered treatment or patient-centered care, the patient should be involved in the core team of the care of the interdisciplinary core team. So patients should be involved and informed equally. So here, what are the strategies sorry, what are the strategies or steps we can follow to reach our goal to improve the quality of life. So these are the points I will be going through as well. Um, Effective symptom management, patient empowerment, psychosocial support, and life participation. So these are the components of patient-centered care, which eventually will lead to improved quality of life and improved survival of the patients on hemodialysis. So talking about managing the symptoms, we know our hemodialysis patients have several symptoms. The commonly reported symptoms could be fatigue, hypotension, cramps, dizziness, sometimes dyspnea, pruritus, sexual dysfunction. And to be honest, sometimes when we talk to the relatives or talk to the patient, for them, the reduction of the symptoms or getting relief from the symptoms are more important than having the survival benefit. They don't talk about the survival to me. They talk about how I can get rid of this itching all the time, or how can I get rid of this fatigue. So these are the symptoms we should be looked into with a proper or an inner care. Looking into the symptom management, first we need to say that why sometimes we cannot really give the patient satisfaction of getting rid of these symptoms. So when I tried to look into this, I got this paper which correctly says that there are several barriers into the symptom management. One of them was the healthcare providers may be unaware of the symptoms, and this is could be because there was under reporting. The patients are not educated about their symptoms. They also think that this is normal to have such things, so they underreported the symptoms. Or the healthcare providers do not feel the symptom management is their role. They think that this is the nurses might think that this is just a nephrologist role, and they keep quiet until the patient symptoms get more aggravated. And sometimes we also, physicians or the healthcare providers, we take for granted that all the symptoms which our patients are getting are due to their underlying disease or because of the CKD. But we don't look into that, what could be the other causes, or what could be the other risk factors why the patient is getting these symptoms. So I think these barriers should be addressed and should be looked into with a serious note. So how can we bridge this gap? First thing, we really need to listen to the patients. We need to give them the time to talk and see what they feel. We ask them, we monitor them closely. Periodic monitor and careful monitor of the patients will really help us to know the warning signs and recognize the patients who are at risk. We should be having the willingness to go beyond of our job descriptions. I know our nurses and technicians, they are very busy. They have a lot of work burden, but still talking to the patients is a very important aspect in a patient-centered care. We need to involve the multidisciplinary team or the other departments, because some symptoms could be because of the underlying pathology, which could be because of the cardiac disease, which could be because of the orthopedic or the neurology department should be involved. Physiotherapy and occupational therapies, they also should be involved equally. And very important thing is individual fit one shoe for all. So very important that we need to individualize our dialysis prescription. So as we have seen that we know that a patient with recurrent volume overload, having uncontrolled or refractory hypertension, cannot just get relief or cannot have adequate dialysis with 2 or 3 times dialysis in a week. Maybe for him, a longer or a more frequent dialysis will be helpful. So here, these studies have shown that more frequent in-center dialysis had both morbidity and mortality benefit, and also impact positively on the quality of life. But we know that we are in the resource limited setting, and we have a lot of challenges in implementing this, both logistic and other feasibility challenges. The other important thing is empowering your patient, improving the efficacy of the patient to taking care of themselves. So what we know that empowered patient, if you empower the patient, he becomes or she becomes an expert in managing himself. He can follow the treatment plan. They can themselves monitor the access, and if there is any errors or any risk or warning signs, they can report it to us. I would really like to say that this is my dream model, to have the share your dialysis. This some parts of the world, I know the Western developed world, where they practice this model of sharing your dialysis, where the patients themselves are given tasks to be followed in their dialysis session, and then they follow, they get motivated, they feel a sense of autonomy, they feel a sense of confidence. So this is very important. And though I know it is very difficult, we are reluctant to give the patients to do their job themselves. But I think slowly, if we can educate our patients, this will be an excellent model to empower our patient. You can see this study has clearly shown us that after the empowerment programs, patient has improved the quality of life, improve mental health status, and improve the survival. So empowering patients is an important aspect of patient-centered care. Next, we go into the psychosocial support. So why it is important and how we can provide it to our hemodialysis patients. So psychological problems are common, and we have to know this, we have to accept this. Depression, about 30% of our patients, they undergo some sort of depression during their after starting the dialysis, and they might be having anxiety, stress, other cognitive disorders, sleep and mood disorders, and a sense of helplessness. And this all can affect negatively into their quality of life and as well as survival. So we really give our attention not only the biochemical parameters, not only getting a KT over V of 1.2 or 1.3, but also to look into these mental health issues. And that's why social workers should be the leader of the team. And we should all have a social worker working with us and helping the patient to improve in these aspects. We should advocate on the dedicated programs for patients' education. We should care for their cultural sensitivity. We should respect their cultural diversity. We also should promote life outside the dialysis, like the children should go to work, they should travel. So promoting life outside the dialysis is very important. And even during dialysis, a lot of patients, they come and they just have 4 hours of dialysis doing nothing. But we should be emphasizing that during these 4 hours, they can do a lot of productive things. Like I know one of my patients, he comes with his laptop and he does online business through during these 4 hours. So educating them and promoting this will help definitely. And time with the care providers away from the chair side, which is important. We take our patients for some time for a picnic, or we can go for a tea date or a coffee date. So that will give them a sense of hope and a lot of happiness. So these things, if we can do, definitely will improve their mental health. Life participation is a very important topic or very important aspect in our day-to-day life. Dialysis is not, or end-stage renal disease is not the end of your life. That has to be informed to the patient. We should inform them, that we should educate them that they should continue their education, continue their work. They should involve in some sort of recreation, either listening to music, sports, anything. And also they should not, hemodialysis should not be a barrier for their travel. So we should make a necessary arrangement that how they can do a live participation. We know that transplant patients are having a much better life participation and freedom compared to dialysis patients. But still, we need to work on how even the dialysis patients can have a better life participation. So, so there are certain things we can do, as we know that we can give them a flexible timing, and maybe somebody is studying in the university, so they can come afterwards in the night during evening hours. We can provide them sometimes transport if they are not having a transport, or giving them other options for RRTs. Like a patient, I remember he used to travel a lot, and for him, hemodialysis was quite hectic, and hence we had to shift him to peritoneal dialysis. So giving such options will help the patient to decide and continue with their life. So I would like to share with this picture. This is one of our patient who recently did his PhD. He's doing his dialysis for last 5 years at our unit, and he completed his PhD on education. And we are really proud of him, and we feel so great and happy that we are part of his journey. We know that in our resource limited setting, where we have a lot of financial constraint and lot of other things to look into, these aspects of dialysis, the mental health and other phenomena are not really given priority, and people are not advocating this. But I think my personal view and is that this is a high time we should give priority in a patient-centered care. Logistically, yes, affordability, we know that to make it individualized, or to have more staff, to have educators, to have a social worker, nutritionist, is quite a bit of expensive work. And sometimes affordability is a challenge, and the insurance coverage, we know that most of our patients are covered through insurance, and which is have a fixed days, like 2 or 3 days in a week only they are allowed to have their dialysis. So in that case, it becomes difficult to individualize the treatment. And others, like we know that patients are coming from far. We have not all the places in the country have the dialysis units, and also the patient's family has huge burden due, maybe the patient is not going to the work and he was the only earning member. So all these can lead to the barrier for a patient-centered care. So this is an important and this is a very interesting study which we recently done by Dr. Rugajo et al. At Minbilly National Hospital, where they looked into the quality of life among HD patients using the kidney disease quality of life short form. It is a tool, it is a very good validated tool, where they looked into several mental components and physical component scoring, and also the effect of kidney disease on the patients. But unfortunately, the results are not that promising. Most of the patients, they score about 48 to below the optimal level, which is above 50%. Hence, we know that there is a huge gap or a huge scope in improving the mental health and the quality of life of our hemodialysis patients. So, but we need to go ahead, and we need to work on it with all other facilities, and we can improve the patient-centered care. So what is the way forward? So we can do our best in sharing the information, and we involve the patient in decision making. We communicate them. We give them time to educate. We give them psychological support. Give their family a support. Talk to the family members, and we, as well as we give the cultural and spiritual support to the patient. So we should not forget the 4 C's of the patient-centered care, which talked about caring, which talked about collaboration. So we always remember these, and if we work on that, I'm sure one day we will be also able to give them a high quality of life and give them hope to live more. So this is the 2021 World Kidney Day, the theme. We know that we need to not treat well. So I believe it's not only treating well, I think it's living well with kidney disease. And this is all about how we live well with our kidney disease, accepting it and involving the patient and the family. So this is my team, and this is my dialysis patients when we had an program on them, education program on empowerment of the dialysis patients last World Kidney Days. And this is my wonderful team who always help me and motivate me to do better. Thank you so much.
Well, I'm getting feedback about the questions. One of the problems I personally have that is on a busy day, the dialysis unit is the last place I want to walk into, because I'll get all sorts of inquiries regarding this pain over my shoulder, this muscle cramp I'm having, the itchiness that it's not being relieved. You told me if I do 3 times a week, it will get relieved. What am I going to do about this fluid overload? Is that a nurse comes to you about a patient with fluid overload with all sorts of things, and that's the time when you're most busy, and therefore you don't have the time to sit down, listen to the patient's complaints empathetically, try to empower them, try to encourage them, try to tell them about the symptomatology, all the things you have talked about patient care. How do you envisage we deal with this? Should there be dialysis symptom specialist, I mean the dialysis unit station there? Should it be a psychosocial workup being around them? What do you think should be done in an average dialysis unit in our settings?
Okay, so thank you, Dr. Wala, for the question. So yes, I know it's a difficult scenario for us. We are busy, but as I told that we need to educate first the patient what the symptoms they have. So they first report to us, then educate our nurses and our the junior doctors or the dialysis unit physician. But ideally, we should have a social worker to each unit, and that is what our national guidelines also say, that each dialysis unit should have a nutritionist and should have a social worker, which will work with the patient and try to look into their symptoms and try to look, and they should be the bridging gap between the patients and the physicians, because maybe we go for rounds, but we cannot be 24/7 with the patients, you see. So social worker plays an important role, but at the same time educating patient, and if we give our bit extra time to them, and I think that can help us, and also involving the other disciplines, the physicians from the other disciplines also can help us that way.
Okay, so thank you very much. And a question from Frederica Wondo about how to allay anxiety of a young patient, 14-year-old lady, about her fertility, a girl about her fertility aspects. Maybe tying that with other things that you have little armamentarium to do about in a dialysis patient. For example, the intractable pruritus. What tell these patients? How do you deal with it? Apart from that question about the fertility of this 14-year-old girl.
Yeah, so so like you see that we know that we give them some kind we try to look into why he's getting it. Is it dermopathy, or is it phosphorus, or is it why the patient is getting this the symptoms, and we try to help according to, we try to address the underlying cause. And if he's not getting involved, sometimes it could be just the psychologically. So we try to involve also the psychologist in that, or psychiatrist in that case. We know we are very reluctant to use antipsychiatry, especially antidepressant, but sometimes they also help. Like so we should not be all the time so much reluctant to use the antidepressants, and sometimes it can improve the symptoms. But we need to learn about the antidepressants and which one can be used. So in that way, we can help the patient.
Thank you very much for once again for your presentation.